You're not a sculptor with the face. Don't think you're some kind of Leonardo da Vinci, or you're not. This is just more kind of like educational. I'm trying to teach people things for life if they do fillers and all that stuff. I put some questions up today. First question was, fillers, the hyaluronic acid ones, the gel ones that we use, they don't go away after 6 to 12 months. They stay there almost permanently to some degree. So the clinical efficacy, or like what you see on somebody's face, you might not notice it. Let's say it's your first filler ever. You might not notice it after 6 months or a year, but it's still in there, which means every time you go back, you're just adding on to it, which means you don't really want to go every 6 to 12 months routinely to get your filler topped up, because you're just adding on to more filler and more filler and more filler. And eventually the facial character changes. You carry more water. So these fillers, yes, they're classified as temporary, but they're permanent. So they keep some gel particles in there, usually permanently. So if you put some in there and you go cut someone up 10 years later, you'll find a little particle in there. Maybe not a lot, but you'll find something. It does sometimes fully go away, but it's safer to assume that you have some in there every time you inject, and it does not go away, as they say. It is false. The dissolvers that we use are called hyaluronidase, and it's a very simple enzyme that cleaves the sugars, basically the cross-linked sugars that are in hyaluronic acid gels. The reason people say online that it melted my face, oh my God, and they perpetuate that notion that it melted fat, is because it can drag a lot of water out of the face. So the hyaluronic acid fillers, they carry water in it. And so if you dissolve even a little bit of gel in the under eye or in the mid face or something like that, you can lose tons of volume. And people think everything is fat in their face, just like they think everything's collagen in their face. People don't understand what's really in the face. So just because you read it online and someone else had a devastating situation and they said the same thing does not mean that you are correct, nor that person is correct. It does mean that they underwent the same issue, but not for the reason that you guys are talking about. So yes, their face looks like it melted because it got dehydrated pretty dramatically, but it's not because it went and melted fat and then you don't have a confirmed source being somebody else who went through the same thing and kind of erroneously came to a conclusion. So next question. The threads I'm talking about, like PDO threads, and Sculptra is the polylactic acid, so the Vicryl suture that's made into powder. And they both can serve as irritants inside the face as they get hydrolyzed. It's actually true, 41%. So they do form collagen in the face, but the reality is actually much spicier. So let's get to the next one. Yes, temporary fillers can stay permanently, and in most cases do stay for longer periods of time than you think. But no, you don't go dissolve them, because every time you dissolve the filler in the face, you're damaging to some extent some of your own hyaluronic acid, which we take as a necessary evil. We have to do that in order to dissolve the filler and fix that. But you don't want to do that if you don't have to. You don't want to dissolve somebody unless you really need to, because you can cause problems from dissolving. Dissolvers can cause issues. Definitely. And that's part of what they call filler fatigue, which is you keep adding this shit to your face more and more and more. And I don't say it like shit, like I use filler, and I use it on my friends and my family. And so I have nothing, I like filler, but you got to know what you're doing, and you got to see these things where you take a young actress who has a delicate face and has tired under eyes, but they look like they could have an allergy to something. You do under eye filler on them, they start dragging in water, and then you keep doing it and they drag in more water. And over time, they just have all this water weight in their face from the filler. And that can happen around here, there, everywhere. And I see it commonly in the jawline when people, especially they want to get that snatched jawline and they go and put those fillers there. It doesn't act like bone, it acts like a spongy gel, and that's what it is. It doesn't go actually build up the bone and make it wider and whatever. So all that stuff that you're adding a water bag, a water balloon to the side of the face. So if you're doing jawline fillers, you got to be delicate, small amounts with it. You're not a sculptor with the face. Like, don't think you're some kind of like Leonardo da Vinci or any of these guys who like were true scientists and artists. Like, you're not. So you shouldn't go and try to get huge changes out of filler. That's wrong. Those big changes that you get, they might look good in a photo. They might look good for a year. But after that, they start gathering water and you get water weight to the face, which is not sexy. And it gets heavy. It's not bone. It's like, it is soft tissue. The point of this one is that yes, threads and Sculptra form collagen in the face. That's true. However, not all collagen is good collagen. There's bad collagen called scarring, fibrosis, granulomas. These are bad collagen in general. So why do we use these things if we know it forms bad collagen? Well, one is because we're smart and we know that we can use bad collagen because it forms bulk. You're forming bulk underneath the skin, just like fat, and you can't get fat for some reason. So you put bulk from scarring, and that's the collagen they're using just to build scar tissue to volumize somebody's face. The other reason we use it is because we're clueless and we don't really understand reality. And there's a lot of practitioners who are just not in touch with reality, either because they haven't experienced it yet, or because they're just never going to be in touch with reality. They're not bright enough. Most of them just haven't been taught properly. The reality is when you put threads into the face or you put sculpture into the face, you're inciting an inflammatory response. So it's an irritant and it sits there and irritates the area, and your body tries to eat it back up and hydrolyze it. In doing so, it starts depositing scar tissue, fibrosis, basically granulation tissue. That's not the same kind of collagen that's in your dermis, which is in your skin. It's very different. It's in a disarray. It's not well organized, but still, we use it to our advantage when we need to, like HIV lipodystrophy or somebody who's super skinny and super gaunt, and we need to build up some scar tissue to add volume to the face. So we use it like that. But to say that it is healthy and develops healthy collagen is 99.9% of the time wrong. There are certain situations where it's correct, but it is 99.9% of the time incorrect. You're not putting collagen back where it used to be or putting it back into the dermis or into the SMAS or anything like that. So this is actually true. You can take bad collagen and use it to your advantage when you're looking at the calculated risk. You're saying, I know I'm going to form granulation tissue, so I'm doing it deep, and I'm trying to build up scar tissue to gain bulk because I have no other way to gain bulk. There's some logic in that and can be defended. To say, let me put Sculptura all under the dermis to try to form more collagen in the dermis, you're kind of pushing it there. Or to say, I'm going to put a thread in the face to form collagen, and that's how I can justify getting a short-term result in someone's brow. No, that's not good justification. And I would say that's not an intellectual thing to say, because it's just not good logic. It's not strong logic. So those are things that I disagree with. If we were to have a debate and we use logic, I would win the debate very quickly. But if people said, yes, I know that it causes scar tissue, I'm putting it in there because I need to form bulk on this person, that's a realistic doctor. And I like them, and I would listen to them. People think that because things are temporary, I'll just try it out and it's great. Guess what? Walking across the freeway is a temporary thing too, but it can cause a big permanent problem if you get hit. Same thing is true with threads and fillers. So threads and fillers, both, they're temporary things. However, they incite an inflammatory response in the face. They both can. And so they can draw in water, they can clog, as fillers go, they can clog lymphatics, they can do other things that are long lasting, even though you think you got something temporary. And same with threads. And again, this is not saying don't do threads. I'm just saying, do not mistakenly think that doing a 1-day quick 2-minute procedure may not stay with you the rest of your life. And if you don't believe me, ask anyone who has gotten herpes. It's a quick thing, easy thing to get, stays with you the rest of your life. So just if you forget, that'll be a good way to remember. Although fillers and threads can be good, herpes is not good. 12% is wrong. Fillers, yes, may easily be found in the face 10 years after. Ultrasound therapy, the classic one is Ulthera. This was a good machine 20 years ago when technology was limited to that. What it does is it passes ultrasonic waves through the skin from this handpiece, and they focus into an area deep into the skin at different depths depending on which handpiece and how it focuses the energy. And it passes that energy, vibrates it, and heats it up. So that's how the ultrasound works. The problem you see with Ulthera is that people use it I'd say too aggressively, because it's 20 years old, and they can't keep up with all the better technology. So they just crank up the energy to get better results because they're not getting good results out of it. So they end up deflating the face. The other problem is people repeat Ulthera like it's a healthy thing. So here's the mistake, is to believe that Ulthera will form some kind of healthy collagen. It is unlikely to produce much healthy collagen, maybe a small amount from inciting an inflammatory response. It can do, but mostly what it does is it microwaves the tissues. It heats them and it shrinks them. So it doesn't get like SMAS tightening like this, like you'd want. It actually just deflates it. So What you have to realize is any heat therapy you repeat over and over again, 3-4 times, any heat therapy can cause repeated inflammatory responses in your face and then start forming fibrosis. So even if you didn't melt the face, you can still cause fibrosis and scarring inside of the face. And you certainly do see that with Ulthera, where you can lose the tissue planes and the mass and all that between the skin down to the muscle, and the face starts looking older about a year later. So I do not recommend repeating it multiple times. I don't think that's a good idea for any heat therapy. The two classic ones that you see that damage people the most and are used the most are Ulthera and Thermage, it seems. And it's likely because you're going to practitioners who over aggressively do it. I've seen people do Ulthera in the neck, get a nice result. I have nothing against that. However, for the face, you don't want to deflate the face. I'd be very cautious. So getting into like the radiofrequency realm of things, radiofrequency can factually actually produce collagen, elastin, hyaluronic acid, depending on the radiofrequency. I tell people, hey, go do Profound. And they always tell me, oh, I've done Profound. I go, really? Not that many people have it. Who'd you do it with? They go, oh, well, I did it at this clinic over here. I'm like, did you do Profound? Or are you just saying you did Profound because you think all radio frequencies are the same? Like, no, I did Profound. I'm like, but I just asked you, did you listen to what I said? Did you do Profound? Or did you do another radio frequency and you're just assuming they're all the same? And they're like, oh, well, yeah, it was a different radio frequency, but it's the same as Profound. And I'm like, no. It's not the same as Profound. And me, I love cars. I always go to a car analogy. It's like trying to say that your Ferrari is the same as my 1988 Toyota. I'm like, they're both cars, they're all the same. They do very different things. So radio frequency is the same thing. They do very, very, very different things. And there's superficial radio frequencies, there's deep ones, there's middle ones, there's Morpheus, which can do multiple levels, which is pretty cool. They all do different things. And some of them don't form much collagen or elastin or hyaluronic acid, and then some form substantial amounts. Yeah, so within the world of radio frequency, there is monopolar, multipolar, and there's bipolar. People don't really understand them, but you can mix the names. Personally, I don't like calling something that has 10 needles with one energy source and 2 grounds on it a bipolar. That doesn't make sense to me because you're dispersing energy in all directions and it can go to either pole. I like to reserve bipolar for 2 poles, so 2 anode and I forgot what to call them. I'm tired. So where negative goes to positive. That's what I like to call bipolar. Not that you have all these different needles and they disperse the energy. I think that's multipolar or monopolar, which realistically is how it acts. Like when you're using monopolar cautery, it has a ground. Ground is different versus something like Profound, and it's a true bipolar. You have 2 needles, they go in, one passes energy directly to the other. That's a true bipolar. You get more control over that and more specific damage to a specific area or depth where it doesn't really spread to other areas. So that's that. So there's a difference. Sure, I like under eye fillers. Small amounts, don't go to full correction, and let it sit for 6 months before you decide to go to more correction, because it can start drawing in water, and it can even draw in water 3 years later and you're like, what's that under my eye? And it can be done by someone like me. I've had it happen tons of times where 3 years later somebody comes back and they have some edema under the eye from filler, because these fillers can migrate. Even though they turn solid after an hour to 3 hours as little gel beads, they can still move over time, either with lymphatic movement or just with, people don't think it moves with capillary motion, but I think small amounts can. Either way, the worst to use in the under eyes, obviously like Juvederm, Voluma, those are terrible. Radiesse, oh my God. I don't understand how anybody would use Radiesse in the under eye, or why, or Sculptra in the under eye, unless you super, super dilute it. Should it be safe at that point? Or Restylane, Refine, Define. Well, I don't know why people get creative. Just use Restylane or Belotero and at least dissolve them easily. Nope, sadly. Any hyaluronic acid is good in the nasolabial fold, and they almost all have indications, like FDA indications for it. Yeah, but it's very low risk if you do it properly. Personally, I do because the way I use it. I love Profound. It's a one-time treatment and it gets a big result. I mean, in the world of radio frequency, whereas if you do Morpheus for the same thing in the face, you got to repeat it 3 to 5 times. And again, I don't like repeating heat treatments in the face. Morpheus is a cooler device in terms of kind of, doing whatever you want with it, because you can do superficial, medium, deep, 1 to 4 millimeters. I think that's great. That's more versatile. But personally, I like to do one thing with it. I like to get just healthier, more dense skin with less shadowing, And Profound does that better than any device ever has. And that is for sure. And it's also, I believe it's safer because as long as you do it properly, if they really inflate the face with fluid, I think it's safer because it's a one-time treatment. I don't like repeating heat treatments in the face. Even if you're being safe about the amount of heat that you're putting in the face, you're inciting an inflammatory response every time. It's like operating on the face 3-4 times. It's gonna get fibrotic and dense at some point. So I don't like repeating heat treatments. Sometimes, not very easily. If you have a big bolus that was placed over like in the corners over here or something, you can remove some of it without damaging the muscles. Otherwise, it incorporates as crystals. I've not used it myself. A bunch of my friends have Infinity and they like it. They like it for like superficial stuff. Again, this is the last time I saw it, it was a couple of years ago. They were using it for more superficial kind of rejuvenation, something that you would do like non-ablative type treatments like that. Well, used to, might go back at some point. I like Clear and Brilliant. It's nice. You can improve the quality of the skin without burning it. So it's a sublative laser. Sublative meaning you're not actually burning it, you're just kind of heating it. And that's nice. Yes, you can, but I wouldn't expect a big result. And I would do it on like thicker skin. Well, there's like cool things that have happened with PRF, platelet-rich fiber red. I've seen some like nice results in the under eye, and I don't know how long it lasts, but it looks really cool. I just haven't done it. Otherwise, plasma doesn't stay. You're just stimulating the skin, which is nice. So let's say someone has like dehydrated, dry skin, and you want to look fresh. You just do the PRP every like 2 months with some micro needling, and it's a nice thing. I don't know much about sculpture butt shots. I just know how sculpture works. It doesn't form that much scar tissue. So it just seems like a very expensive treatment to go try to bulk up someone's ass by putting sculpture. Like those things are expensive. So I would want a definitive result if I'm paying that much. And I don't think it provides a definitive result, but I'm not a specialist in it. That's just my educated guess. I perform a lot of facelifts under 40. The large majority in my practice is probably like 42 to 60, that range, but I do perform a lot under 40. I don't perform it all willy-nilly. I perform it because somebody has hyperlaxity and they're hyperlax, droopy, or they have acne, heavy face. And I feel as though doing heat treatments like Profound or things like that, or doing filler is not going to get them to where they want to be, but I can with a surgical procedure and I can do it safely. So I look at it as a technician. I'm not thinking, okay, how old are they? I'm looking at the face. Because for me, a facelift is not an age-related procedure. It has an age correlation, but I don't have that as a criteria or a threshold to say, okay, you're 25 years old, I can't do it. No, I look at the face. If it's droopy like this, and it's not because of just simple volume deflation, they really have all this elasticity, then I think to myself, well, I'm a technician, mechanic, I can go make some cuts, release it, lift it. I can do it safely without any trade-off. So I do it on a lot of patients, many patients under 40, late 30s. I've done it with patients 25, 26, 27 years old because they have either a slope neck, meaning a neck that goes from like here to here. I do a weekend lift on them, or they have acne and droopy cheeks and I lift it because of that. Those patients don't heal as well in terms of scarring in general because they're acne forming skin that's hyperelastic. So you do have to give them more treatments to make it invisible versus other patients like you don't see the scar at all. So you do have to be more cautious on younger people. It's a mistake to think that younger people need mini lifts. That's completely incorrect. If you're going to do a younger person, you have to assume that they're getting it because they have worse skin, or look at their skin and you can tell. And the other is that they have more density in the skin. So you do have to actually release them more. So this whole mini lift thing, 99% of the time is incorrect. It is wrong. It should not be done on younger people. On younger people, if you're going to do it, you got to do it properly. You have to go release the tension of the face and bring it up. Endoscopic lifts, different. You can do an endoscopic lift and get away with it without much loss, but you do form pixies sometimes if you try to tighten the neck too much without releasing everything. People use radiofrequency usually for that. A million things. I love Nutrafol. People sometimes try to do 4 pills in the day, but I think it's 4 pills at once. It's fine. So jowls. Doctors are very confused as to what jowls are. Jowls are a drooping that occurs. You could have like jowls back here, technically like a dog, but we're usually talking about this area going right down to here. These are the jowls, but this whole thing could be jowling, just like those dogs, whatever they're called. So this could all be jowling, but generally we're talking about this fold right here. So if you look at the shadows in the face, you've got 1, 2, 3 shadows that form in the front of the face. So the nasal jugal groove, nasal labial fold, and the prejowl fold, the prejowl sulcus going down into here. What happens is the face is up here, it's inflated, it's lifted, and then over time it kind of sags down and you get a deflational line that goes across here. When you smile, you can see the nasolabial fold gets darker, and then down over here, and then there's gathering of tissue here. This is not fat. You didn't all of a sudden just gain fat here. So people go try to liposuction it, and they try to do Kybella and this and that. They do not get consistent results. So one person might get a result because they somehow contour them nicely, but it's not consistent, and they can cause nerve damage by doing stuff around there. So you have to be cautious. So in general, the solution for jowls, number one, you can just do filler. You can filler right in front of it and you get a decent result. Number two, radiofrequency. You could do profound, you could do face tight, you could do all those kind of things. I'd be cautious with a wand going above the jawline because you can cause an indent in the skin. It's very hard to fix. And the last thing is lifting. And that is a nice, easy thing to do. I'd say we call it, well, that's nice. If you want to catch me, I'll be at the office for another couple hours at the end of this day.